This is the mineral far above the rest most closely related to cancer. Its deficiency may be stealthily bringing you closer to this deadly disease, but be careful because cancer cells also use it to their advantage. Yes, I'm talking about magnesium, and today you're going to fully understand its relationship with cancer. At the end of the video, I'll give you a 7-step guideline to optimize your magnesium as much as possible without supplements and ideally keep cancer at bay. I'm Dr. Bora Bandera, a specialist in endocrinology and nutrition, and today we're studying the relationship between magnesium and cancer. Magnesium deficiency worsens all the cellular processes that cause aging in your cells, the so-called hallmarks of aging. That's exactly what this interesting study reviews, which I recommend you read. Lack of it accelerates everything that causes you to age. Since cancer is one of the diseases most typically associated with aging, it's worth asking, what role does this mineral play in the prevention or even treatment of oncological processes? That's what we're doing now. Low magnesium in cells leads to immune dysfunction, raising baseline inflammation and oxidative stress. These two elements are accelerators of mutations and errors that ultimately initiate a clinical process. They are, to put it simply, like a perfect breeding ground for cancer. For that reason, their deficiency is related not only to cancer, but also to other chronic diseases that share a common state of low-grade chronic inflammation. Cardiovascular disease, type 2 diabetes, asthma, depression, greater vulnerability to stress, or gastrointestinal disorders. Now let's discuss its link to cancer. It's not surprising that it has an influence since magnesium-deficient cells also have greater genomic instability. Remember that magnesium acts as a cofactor in the synthesis of DNA, ribonucleic acid proteins, in cell proliferation, in energy production, in oxidative phosphorylation, in glycolysis, and in intracellular signaling of something as important as insulin. Therefore, maintaining an optimal magnesium balance throughout all stages of life is a defensive barrier against diseases associated with aging. And diabetes. Higher cell levels could give a metabolic advantage, enabling them to develop the immortal, non-dying phenotype seen in cancer. But on the other hand, magnesium can suppress carcinogenesis in a way that depends on its concentrations. This is evident in deficient animals with higher cancer risk, and the same occurs in most cancer patients. And that's because optimal levels would contain the risk, protecting the DNA of the cells, reducing mutations, and lessening the invasion of tumor cells. But if we want to make things even more complicated, hypomagnesemia, which is associated with some cancer treatments and is a very common problem, could produce an inhibitory effect on tumor growth and neoangiogenesis, the tumor's use of new blood vessel formation, to its advantage. This may seem beneficial initially, but hypomagnesemia is a serious issue that must be addressed. In people with cancer, magnesium is linked to worse outcomes and more systemic inflammation. So what's going on? How do we reconcile all this contradictory information? Well, the hypothesis I have is just a hypothesis. It's that both healthy cells and cancer cells use magnesium to their advantage to generate energy, stay alive, and grow. In this sense, the ideal would be to deprive cancer of magnesium while sufficiently supplying magnesium to healthy cells. Although we don't know how to do this. We need to look past preclinical studies. What do large population studies show? In this study, involving 412,000 participants across 12 studies, in prospective studies with 8 to 14 years of follow-up, people who consumed the most magnesium had a lower risk of any cancer. Which cancer type is most affected by magnesium deficiency? Colorectal cancer is most clearly linked to low intake and is very common. But what about the others? Can we draw conclusions? Of the few strong studies, Bacheris stands out. It's a meta-analysis of 19 prospective studies covering 11,400 cancer deaths. It aims to explain the link between supplemented, dietary, and total magnesium and the risk of cancer and cardiovascular disease. The conclusions are very interesting. As expected, dietary magnesium intake was associated with a lower risk of mortality from any cause and from cancer, but the same was not found with magnesium. supplementation. How? The study found each extra 100 milligrams of dietary magnesium reduced overall mortality by 6% and cancer mortality by 5%. Why these findings? People who eat more magnesium also consume more leafy greens, fruits, vegetables, legumes, and seeds, which are generally protective, including against cancer. However, the same protective effect is not achieved with supplements, because it's not just the magnesium, but everything that foods provide. In those who magnesium to mom. And isn't this what has been shown to keep you away from cancer? So what do? Reviewing all the evidence, adequate magnesium levels appear to protect against certain cancers. But the truth is that the clinical translation of this experimental and epidemiological data has not arrived yet. And we don't know what role supplementation plays in cancer prevention, but where is magnesium found? Are we still not consuming enough to prevent disease? That's well supported by evidence, as you know. That's why I'm bringing you up to 7 little-known actions to ensure you have sufficient levels of this mineral. First, the bioavailability of magnesium can be adjusted up or down. Yes, we know magnesium is found in green leafy vegetables, whole grains, legumes, pseudo-cereals like quinoa, buckwheat, amaranth, seeds, nuts, and cocoa. But what we usually don't know are the factors that increase and decrease its bioavailability. Vitamin D and B6 fermentable fiber and soluble fiber increase it. Magnesium dissolved in water is more bioavailable than the magnesium found in food, which is interesting. Whey proteins, including whey protein, also raise it. What lowers it? Food processing. That's why ultra-processed diets contain less magnesium. Excessive calcium intake, alcohol, soft drinks, coffee, and some medications like proton pump inhibitors, loop diuretics, or thiazides. That lowers bioavailability. Second point, pumpkin seeds, almonds, and cashews have the most magnesium among nuts. Third, steaming or sautéing vegetables keeps more magnesium than boiling because magnesium remains in the water. Fourth, many mineral waters, they provide more than 50 milligrams of magnesium per liter. 2 liters a day can add an extra 100 milligrams of highly bioavailable magnesium. It all adds up, especially since most of us don't eat enough vegetables. Fifth, high sodium diets increase magnesium loss. Raising your potassium to sodium ratio helps retain more magnesium. Sixth, does it control or improve conditions that cause you to lose magnesium? Insulin resistance, chronic diarrhea, malabsorption, uncontrolled hyperthyroidism, vitamin D deficiency. Monitor chronic stress as well. Seventh, daily saunas can make you lose up to 30% more. Do you have more tools? If you want to know the best magnesium for your brain, watch this video. See you next time. Big hug. Let's keep empowering.